how do you address that with the patient?
No,
you know, I'm a worrywart, so maybe it's just me.
We both are too.
Yeah, yes.
Absolutely. And I would say it's a really personal decision,
Sure,
right?
yeah.
Whether someone wants to have this kind of information or not becomes, again, is very personal. You know, the side of me that advocates for it and the part of me that supported myself to go ahead and have genetic testing is that by having the information, I feel empowered, right?
Sure, yeah.
Similar to your friend with the child with the cleft palate, I feel empowered to be able to take action to support myself to stay healthy. You know, not having the information doesn't change your status.
Sure.
It just changes your ability to take action earlier. So, I don't know what
Any advice from you, Dr.
Yeah.
Powell?
Exactly that. I think that you know, the idea is being proactive enough that you can, ideally prevent disease altogether. But at least potentially catch it early. So we know that when, again, to use the example of cancer, when cancer is diagnosed late, after it has already spread, it tends to be a terminal diagnosis. And so, because it can no longer be surgically removed, and there are too many genomic changes and therapies are less effective. But if you know you have a risk factor and you do get into screening programs sooner, then you can potentially catch that disease while it is still in a curable stage, or at least a very treatable stage. And that's important, especially because usually when screening programs like mammograms, for example, those tend to be covered by insurance according to medical guidelines that say at age 40, women now qualify to get their mammogram. Right. But if a woman knows that she has a mutation in a BRCA1 or BRCA2 gene, then her insurance might actually pay for that mammogram before the age of 40, with the idea being that they can catch that cancer a little bit sooner.